Nurse Sarah Mitchell adjusted her hospital ID badge as she approached the glass doors of the Metropolitan Medical Center's annual Excellence in Healthcare Gala. Her 12-hour shift had just ended, but she'd promised to attend the award ceremony where her pediatric unit was being honored. "Sorry, staff entrance is around back," the security guard said, blocking her path despite her clearly visible hospital credentials. "This entrance is for VIP guests and donors only." Sarah tried to explain she was invited to the ceremony, but the guard, Marcus Webb, cut her off. "Ma'am, please don't make this difficult. People dressed like that don't belong at premium events." What Marcus didn't know was that the security camera was recording everything, and in 30 minutes, the woman he'd just humiliated would be performing CPR in the parking lot on the hospital's biggest donor, while the entire incident streamed live to thousands of viewers. If this story resonates with you, please like this video, subscribe to our channel, and let us know in the comments where you're watching from today. Sarah Mitchell had dedicated 18 years of her life to nursing, but she had never encountered the stark class divisions within healthcare, quite like those displayed at Metropolitan Medical Center's annual Excellence in Healthcare Gala. The event, held each November in the hospital's newly constructed wing, was designed to celebrate medical achievements while raising funds from the city's wealthiest philanthropists and medical industry leaders. The irony wasn't lost on Sarah that the same hospital where she worked 16-hour shifts treating the city's most vulnerable patients also hosted lavish events where individual table settings cost more than many of her patients' monthly medication budgets. But her pediatric intensive care unit had been selected to receive the Outstanding Patient Care Award, and despite her exhaustion from a particularly challenging shift, she felt obligated to represent her team at the ceremony. The Metropolitan Medical Center had undergone a dramatic transformation over the past decade under the leadership of Dr. Victoria Ashworth, the hospital's chief executive officer. Dr. Ashworth had successfully repositioned the institution from a community hospital, serving diverse populations, to a premier medical destination, attracting wealthy patients and prominent physicians from across the region. This transformation had brought undeniable benefits: state-of-the-art equipment, expanded research capabilities, and facilities that rivaled the finest private hospitals in the country. The emergency department featured private treatment rooms with luxury amenities. The surgical suites contained the latest robotic technology, and patient rooms resembled hotel suites more than traditional hospital accommodations. But the changes had also created a two-tiered system within the hospital itself. Certain floors and wings were designated for premium patients who paid cash or had exceptional insurance coverage, while other areas served patients with limited resources or government insurance. The staff who worked in these different areas rarely interacted, creating invisible boundaries that reflected broader social and economic hierarchies. Sarah worked in the pediatric intensive care unit, which served children regardless of their family's financial circumstances. Her unit occupied an older section of the hospital, with equipment that was functional but outdated compared to the premium facilities available in other departments. The nursing staff in her unit carried heavier patient loads and worked longer shifts, often staying beyond their scheduled hours to ensure that critically ill children received necessary care. The contrast between Sarah's daily work environment and the gala's opulent setting was jarring. The event was held in the hospital's new Millennium Wing, a gleaming addition that featured marble floors imported from Italy, crystal chandeliers handcrafted in Austria, and artwork commissioned from internationally recognized artists. The space had been designed to impress wealthy donors and convince them that their contribution supported an institution worthy of their philanthropic investments. Dr. Ashworth's approach to hospital management emphasized image and perception as much as medical outcomes. She believed that attracting affluent patients and donors required creating an environment that reflected wealth and success. arguing that prestigious appearances would ultimately benefit all patients by generating revenue that could support comprehensive medical services. The hospital's board of directors, comprised primarily of business leaders and wealthy philanthropists rather than healthcare professionals, had enthusiastically supported Dr. Ashworth's vision. They approved budgets that prioritized visible improvements and luxury amenities while maintaining minimal staffing levels in departments that served less profitable patient populations. Sarah had watched these changes with growing concern over her years at Metropolitan Medical Center. While she appreciated the benefits of modern equipment and improved facilities, she worried about the increasing emphasis on profit margins and customer satisfaction scores, rather than traditional measures of medical quality and patient outcomes. The nursing staff in her unit had been reduced by 20% over the past 3 years, despite steady increases in patient acuity and volume. Nurses were expected to manage more patients with more complex conditions while maintaining satisfaction scores that met corporate benchmarks. The pressure was exhausting and sometimes compromised the personalized care that Sarah believed was essential for healing. But Sarah continued working at Metropolitan Medical Center because she loved caring for children and felt a deep commitment to serving families who had nowhere else to turn for specialized pediatric care. Her unit treated children with complex medical conditions that required expertise and resources unavailable at smaller community hospitals. Many of her patients came from families who had traveled hundreds of miles and spent their life savings seeking treatment that could save their children's lives. Sarah's reputation within the pediatric medical community extended far beyond Metropolitan Medical Center. She had authored numerous articles in nursing journals about pediatric intensive care, developed training protocols that were used by hospitals across the country, and served as a mentor to hundreds of nursing students and new graduates who sought her guidance. Her expertise was particularly renowned in the area of pediatric cardiac care, where her quick thinking and clinical skills had saved countless children's lives. She had an intuitive ability to recognize subtle changes in patients' conditions that could indicate life-threatening complications, often identifying problems before sophisticated monitoring equipment detected abnormalities. Physicians regularly sought Sarah's input on complex cases, valuing her insights gained from years of hands-on patient care experience. Residents and medical students requested rotations in her unit specifically to learn from her clinical expertise and patient care approach. Her reputation for excellence had earned her offers from prestigious hospitals across the country, including positions that would have doubled her salary and provided opportunities for career advancement. But Sarah had consistently declined these offers, choosing to remain at Metropolitan Medical Center, where she felt her skills were needed most. Many of the children in her unit came from families who had already exhausted their financial resources seeking medical care, and Sarah knew that her advocacy and expertise were often their only protection against healthcare systems that prioritized profit over patient welfare. The invitation to the Excellence in Healthcare Gala had been somewhat surprising to Sarah, given that nursing staff rarely attended the hospital's premium fundraising events. These occasions typically featured physicians, administrators, and donors, with nursing staff providing behind-the-scenes support rather than recognition as healthcare professionals worthy of celebration. But the Pediatric Intensive Care Unit's selection for the Outstanding Patient Care Award had required representation from the nursing staff who actually provided the direct patient care that distinguished the unit's performance. Sarah had been chosen by her colleagues to accept the award on behalf of their team, recognizing her leadership role and her ability to articulate the challenges and rewards of pediatric intensive care nursing. The award itself was meaningful to Sarah and her colleagues, representing external recognition of their commitment to providing exceptional care, despite resource constraints and administrative pressures that made their work increasingly difficult. The pediatric intensive care unit consistently achieved patient outcomes that exceeded national benchmarks while maintaining family satisfaction scores that reflected their compassionate approach to care. But preparing for the gala had been challenging for Sarah, who owned few clothes suitable for formal events and had limited time to shop for appropriate attire. Her nursing salary, while adequate for basic living expenses, didn't include a budget for designer dresses or professional styling services. She had borrowed a simple black dress from a friend and hoped that her appearance would be appropriate for the elegant event. The day of the gala had been particularly demanding at the hospital, with multiple emergency admissions to the pediatric intensive care unit requiring Sarah's immediate attention and expertise. A 3-year-old with respiratory failure had required emergency intubation. A 7-year-old with traumatic brain injury needed constant neurological monitoring, and a newborn with complex congenital heart defects required precisely calibrated medication adjustments every few hours. Sarah had stayed 3 hours beyond her scheduled shift to ensure that all of her patients were stable and that the evening nursing staff had complete information about their conditions and treatment plans. She had considered skipping the gala entirely, but her colleagues had insisted that she attend to represent their unit and accept recognition that they all deserved for their dedication to pediatric patient care. The transition from the intense medical environment of the pediatric intensive care unit to the formal social atmosphere of the gala was disorienting for Sarah. She had barely had time to change from her nursing scrubs into the borrowed dress, and she felt self-conscious about her appearance compared to the elegantly dressed guests who were arriving for the event. The hospital's main entrance had been transformed for the occasion, with red carpet extending from the street to the lobby and professional photographers capturing images of distinguished guests as they arrived. Valet parking attendants in formal uniforms managed luxury vehicles, while security personnel ensured that only invited guests and approved vendors entered through the prestigious front entrance. Sarah approached the main entrance with some hesitation, uncertain whether her invitation and hospital identification would be sufficient to gain entry through the formal checkpoint that had been established for the event. She had assumed that as a hospital employee receiving an award, she would be welcomed at the main entrance used by other honored guests. Marcus Webb had been working as a security guard at Metropolitan Medical Center for 8 years, but his role had evolved significantly under Dr. Ashworth's leadership to emphasize image management and crowd control rather than traditional security functions. He had been specifically trained to recognize and accommodate VIP patients, donors, and distinguished visitors, while ensuring that the hospital maintained an upscale atmosphere appropriate for its premium positioning. Marcus took pride in his ability to distinguish between people who belonged in the hospital's elite areas and those who might compromise the institution's carefully cultivated image. He had developed what he considered sophisticated judgment about appropriate dress, behavior, and social indicators that separated premium guests from ordinary hospital visitors. His training had emphasized the importance of protecting the hospital's reputation and ensuring that wealthy donors and influential patients felt comfortable in an environment that reflected their social status and economic standing. Marcus believed that his vigilance in maintaining these standards contributed to the hospital's success in attracting philanthropic support and premium patients. When Sarah approached the main entrance in her simple black dress and practical shoes, carrying the hospital identification that she wore proudly every day, Marcus immediately categorized her as someone who didn't belong at the prestigious gala. Her appearance suggested to him that she was either confused about the location or attempting to gain inappropriate access to an exclusive event. "Sorry, staff entrance is around back," Marcus said firmly, positioning himself to block Sarah's path, despite her clearly visible hospital credentials hanging from a lanyard around her neck. "This entrance is for VIP guests and donors only." "Maybe The dismissal was immediate and categorical, based entirely on Marcus's superficial assessment of Sarah's appearance, rather than any attempt to verify her invitation or understand her role in the evening's program. His tone conveyed not just instructions about using a different entrance, but a clear message that someone dressed like Sarah didn't belong at an event celebrating healthcare excellence. Sarah was momentarily stunned by the interaction, having expected that her hospital identification and invitation would be sufficient to establish her legitimacy as an invited guest. She had not anticipated facing class-based discrimination at her own workplace, particularly when attending an event specifically designed to honor her unit's exceptional patient care. "I'm actually invited to the ceremony," Sarah explained politely, reaching into her purse to retrieve the formal invitation that had been sent to her home address. "My unit is receiving an award tonight, and I'm here to accept it on behalf of my colleagues." But Marcus remained unmoved by her explanation, interpreting her response as an attempt to manipulate her way into an exclusive event where she clearly didn't belong. His training had taught him to be suspicious of people who claimed special access or made excuses for their inappropriate appearance at premium hospital events. "Ma'am, please don't make this difficult," Marcus replied with growing authority, enjoying the attention his confrontation was attracting from other guests and security personnel. "People dressed like that don't belong at premium events. If you're really hospital staff, use the employee entrance and speak with your supervisor about appropriate dress codes." The humiliation was public and deliberate, designed not just to exclude Sarah from the event, but to reinforce social hierarchies that separated healthcare workers from healthcare leaders. Marcus's comments suggested that Sarah's appearance indicated either deception or ignorance about appropriate behavior for hospital-sponsored events. Other guests arriving for the gala paused to observe the interaction, some expressing amusement at Sarah's apparent confusion about proper protocols for accessing exclusive medical events. The security checkpoint became a spectacle that reinforced assumptions about who belonged in healthcare leadership roles and who should remain invisible in support positions. Dr. Jennifer Martinez, a cardiologist who had worked closely with Sarah on numerous pediatric cases, recognized her colleague but hesitated to intervene in what appeared to be a security matter. Dr. Martinez valued Sarah's nursing expertise and had personal knowledge of her professional accomplishments, but speaking up would mean challenging hospital security procedures and potentially creating an embarrassing scene. The medical staff who witnessed Sarah's humiliation faced a complex social calculation about whether to risk their own professional standing by supporting a nurse against hospital security policies. While they respected Sarah's clinical skills, the hierarchical culture of the institution discouraged physicians from challenging administrative decisions or security protocols. Sarah felt the weight of public scrutiny as other guests watched her unsuccessful attempt to gain entry to her own workplace for an event honoring her professional achievements. The humiliation was compounded by the realization that people she worked with daily were choosing not to advocate on her behalf when she faced obvious discrimination. "I understand there may be confusion," Sarah said with as much dignity as she could maintain, "but I received an official invitation and I'm here to represent the pediatric intensive care unit that's being honored tonight. Could you please check with someone about the appropriate protocol?" Marcus's response demonstrated the power dynamics that governed access to elite medical events. "Ma'am, I'm not going to debate this with you. Either use the service entrance or leave the premises. You're holding up the line and making our legitimate guests uncomfortable." The word legitimate was particularly stinging, implying that Sarah's presence was inherently problematic and that her attempt to enter through the main entrance represented some kind of fraud or social transgression. The public nature of the rejection sent a clear message about who was welcome in the prestigious spaces of contemporary healthcare. But what Marcus and the assembled guests didn't realize was that the entire interaction was being recorded by the hospital's security cameras, which had been upgraded to live streaming capabilities to provide real-time monitoring of all entrances during special events. The footage was automatically uploaded to the hospital's administrative network and would soon become evidence of systemic discrimination within the institution. Sarah finally accepted that she would not be allowed to enter through the main entrance and began walking toward the service entrance that Marcus had indicated, feeling humiliated but determined to attend the ceremony where her unit would be recognized. She had no way of knowing that her professional competence and compassion would soon be tested in the hospital parking lot, where her response to a medical emergency would demonstrate exactly why she deserved recognition as an outstanding healthcare professional. The emergency in the parking lot. As Sarah walked around the building toward the service entrance, she heard a commotion near the valet parking area where luxury vehicles were being managed by the hospital's premium guest services. A woman was crying for help in Spanish, frantically gesturing toward an elderly man who had collapsed beside a black Mercedes sedan. Sarah's nursing instincts immediately overrode her personal frustration about the humiliating entrance denial. She rushed toward the emergency, quickly assessing the situation as she approached. The elderly man appeared to be unconscious, with visible signs of respiratory distress and possible cardiac arrest. ¿Qué pasó? Sarah asked the woman in Spanish, kneeling beside the unconscious man while beginning her clinical assessment. The woman, later identified as Maria Santos, explained through tears that her husband Eduardo had suddenly complained of chest pain and difficulty breathing before collapsing while waiting for their car. Eduardo Santos was a prominent philanthropist and major donor to Metropolitan Medical Center, having contributed over $2 million to the hospital's capital campaigns and equipment purchases. He was attending the gala as a guest of honor, scheduled to receive recognition for his charitable contributions to pediatric medical services. But in that moment, Eduardo's wealth and social status were irrelevant to Sarah, who saw only a human being in medical crisis, requiring immediate intervention. She quickly checked his pulse and breathing, recognizing the classic signs of cardiac arrest that required immediate cardiopulmonary resuscitation. "Call 911 immediately," Sarah instructed Maria while positioning Eduardo for CPR. "Tell them we have an elderly male in cardiac arrest at Metropolitan Medical Center." She began chest compressions with the precise technique that she had performed countless times during her nursing career. The valet parking attendants and other guests gathered around the emergency scene, but none had medical training or experience with life-threatening situations. They watched helplessly as Sarah took control of the crisis with professional competence that demonstrated why nursing expertise was essential for saving lives in emergency situations. Sarah's CPR technique was textbook perfect, with compressions at the correct depth and rhythm to maintain circulation, while Eduardo's heart was unable to pump effectively. She periodically checked for pulse and breathing while continuing resuscitation efforts, drawing on 18 years of experience with pediatric and adult emergency situations. What Sarah didn't realize was that her emergency response was being broadcast live to thousands of viewers through the hospital's security camera system, which had been configured to stream special events to donors and community partners who couldn't attend in person. The cameras that were meant to capture elegant gala arrivals were instead documenting a real-life medical emergency and the professional competence of a nurse who had been denied entry to her own workplace. Dr. Patricia Chen, the hospital's chief of cardiology, arrived at the scene after being summoned from the gala by security personnel who recognized that a medical emergency required physician oversight. She immediately recognized Sarah as one of the most competent nurses in the hospital and was relieved to see that Eduardo was receiving expert emergency care. "Sarah, what's his status?" Dr. Chen asked while kneeling beside them to assist with the resuscitation efforts. Her question demonstrated the professional respect that Sarah commanded among physicians who understood the critical importance of skilled nursing care in emergency situations. "Witnessed cardiac arrest approximately 3 minutes ago," Sarah reported while continuing chest compressions. "No pulse, no spontaneous breathing, CPR in progress. Wife reports chest pain and shortness of breath prior to collapse." The professional communication between Sarah and Dr. Chen illustrated the collaborative relationship that characterized excellent medical care, where nurses and physicians work together as equals in life-threatening situations. Sarah's clinical assessment was precise and complete, providing Dr. Chen with essential information for managing Eduardo's emergency care. Emergency medical services arrived within 7 minutes of Maria's initial call, but by that time, Sarah had already maintained circulation through continuous CPR that would prove crucial for Eduardo's survival. The paramedics recognized Sarah as a healthcare professional and seamlessly integrated her information into their emergency protocols. "We've maintained circulation for approximately 10 minutes, Sarah reported to the lead paramedic. "Patient's wife reports history of hypertension and diabetes, currently taking multiple cardiac medications, no known drug allergies." The paramedics transported Eduardo to the emergency department at Metropolitan Medical Center, where he would receive advanced cardiac care, including emergency cardiac catheterization and stent placement. Dr. Chen accompanied the transport team, ensuring continuity of care from the parking lot emergency through definitive hospital treatment. But Sarah remained in the parking lot, covered in dirt from kneeling on the pavement and emotionally drained from the intensity of performing emergency resuscitation. She had saved Eduardo's life using skills and knowledge that she applied daily in her nursing practice, demonstrating exactly the kind of clinical excellence that the gala was supposedly designed to celebrate. Maria Santos approached Sarah with tears of gratitude, embracing her and thanking her repeatedly, in both Spanish and English, for saving her husband's life. "You are an angel," Maria said. "God sent you to save Eduardo. How can we ever thank you?" Sarah accepted Maria's thanks graciously while explaining that providing emergency care was simply part of her professional responsibility as a registered nurse. She didn't mention the humiliation she had experienced earlier at the hospital entrance, focusing instead on ensuring that Maria had transportation to the emergency department where she could be with Eduardo during his treatment. Other guests who had witnessed the emergency began approaching Sarah to express their amazement at her professional competence and their gratitude for her life-saving intervention. Many had never seen emergency medical care provided with such skill and dedication, and they were beginning to understand that healthcare excellence required much more than elegant facilities and sophisticated equipment. But what none of them realized was that the entire incident had been captured on live streaming video that was being viewed by hospital board members, medical staff, and community leaders who were following the gala remotely. The contrast between Sarah's professional competence in the parking lot and her earlier treatment at the hospital entrance was creating a public relations crisis that would demand immediate administrative response. Dr. Victoria Ashworth, the hospital's chief executive officer, received an urgent call from the hospital's communications director while she was delivering opening remarks at the gala. The security footage of Sarah's entrance denial, followed by her life-saving emergency response, had already been viewed by thousands of people and was generating intense criticism on social media platforms. "We have a serious situation," the communications director explained. "The nurse who was denied entry to the gala just saved Eduardo Santos's life in our parking lot, and the whole thing is going viral. People are calling it discrimination against healthcare heroes." Dr. Ashworth realized immediately that the hospital faced a public relations disaster that could damage relationships with donors, undermine community trust, and create legal liability for discriminatory treatment of employees. The irony that Sarah had been excluded from an event celebrating healthcare excellence, while simultaneously demonstrating that very excellence was not lost on viewers who were sharing the footage widely. The live streaming of Sarah's emergency response had inadvertently created the most powerful demonstration possible of nursing expertise and its essential role in healthcare delivery. Viewers could see the calm professionalism with which Sarah managed a life-threatening emergency, the respect she commanded from physicians and paramedics, and the gratitude of a family whose loved one's life she had saved. Meanwhile, Marcus Webb remained at his security post, unaware that his treatment of Sarah was being broadcast live to thousands of viewers who were expressing outrage at the discrimination she had faced. His superior attitude about protecting the hospital's image was being exposed as exactly the kind of superficial thinking that ignored the true sources of healthcare excellence. The juxtaposition of images, Sarah being turned away from the hospital entrance, followed immediately by her saving Eduardo's life, created a narrative about healthcare priorities that would resonate far beyond the immediate circumstances of the evening. Viewers were seeing first-hand evidence that appearances could be deceiving and that real healthcare heroes might not look like the polished professionals featured in hospital marketing materials. Within minutes of the emergency, social media platforms exploded with commentary about the stark contrast between Sarah's treatment at the hospital entrance and her life-saving intervention in the parking lot. The hashtag #HealthcareHero began trending nationally as viewers shared the footage with their own networks, expressing outrage at the discrimination Sarah had faced and admiration for her professional competence. The live stream had captured every detail of both incidents. Marcus Webb's dismissive treatment of an accomplished nurse followed immediately by that same nurse performing flawless emergency resuscitation on the hospital's most prominent donor. The visual narrative was so compelling that news stations began picking up the story for their late-night broadcasts. Dr. Jennifer Martinez, who had witnessed Sarah's humiliation at the entrance but failed to intervene, now felt compelled to speak publicly about her colleague's professional reputation and the injustice she had observed. Sarah Mitchell is one of the most skilled nurses I've ever worked with, Dr. Martinez posted on her professional social media account. What happened tonight was discriminatory and wrong. She deserved respect, not humiliation. Her post was shared thousands of times by healthcare professionals who recognized the broader implications of the incident for how nurses and other healthcare workers were perceived and treated within medical institutions. The story had touched a nerve about professional hierarchy and recognition that extended far beyond Metropolitan Medical Center. Meanwhile, inside the gala, Dr. Ashworth was struggling to manage the crisis while maintaining the evening's planned program. The Outstanding Patient Care Award that was meant to honor Sarah's unit had become a focal point for uncomfortable questions about how the hospital actually treated its most dedicated employees. Board members who had witnessed the live stream were demanding immediate explanations for the security policies that had excluded an award recipient from her own recognition ceremony. The hospital's largest donors were expressing concerns about an institutional culture that appeared to devalue the very healthcare professionals who delivered the excellent patient care that justified their philanthropic investments. "Ladies and gentlemen," Dr. Ashworth announced to the gala audience, "I need to address an incident that occurred this evening at our hospital entrance. Due to a serious misunderstanding, one of our most distinguished nurses was inappropriately denied entry to tonight's ceremony. We are investigating this matter immediately and will take corrective action." But her carefully worded statement did little to address the fundamental questions about discrimination and professional respect that the incident had raised. Attendees were quietly checking their phones and sharing the viral footage among themselves, creating an uncomfortable atmosphere that overshadowed the evening's intended celebration of healthcare excellence. Dr. Patricia Chen returned to the gala after ensuring that Eduardo Santos was stable and receiving appropriate cardiac care in the emergency department. She immediately sought out Dr. Ashworth to provide a first-hand account of Sarah's professional performance during the medical emergency. "Victoria, I need you to understand what happened out there," Dr. Chen said urgently. "Sarah Mitchell saved Eduardo Santos's life with textbook-perfect emergency care. Her clinical skills were flawless, and she handled the entire situation with the kind of professional competence that this hospital should be celebrating, not excluding." The irony was unmistakable. While the gala was formally recognizing healthcare excellence, the most dramatic demonstration of that excellence had occurred outside the building by a nurse who had been denied entry to her own recognition ceremony. As news of the incident spread beyond social media to mainstream news outlets, Metropolitan Medical Center began receiving calls from journalists seeking interviews and statements about the hospital's policies regarding staff treatment and discrimination. The communications department was overwhelmed by media requests that threatened to transform a positive fundraising event into a public relations disaster. The hospital's patient advocacy department also began receiving calls from families whose children had been treated in Sarah's pediatric intensive care unit. Parents who had witnessed Sarah's compassion and expertise during their own medical crises were expressing outrage that she had been treated disrespectfully by the same institution that had benefited from her dedication. Elena Rodriguez, whose daughter had survived a complex heart surgery, largely due to Sarah's post-operative care, called the hospital's administration directly. "Sarah Mitchell held my hand while my daughter was dying," Elena told the chief administrative officer. "She worked extra shifts to monitor her recovery, and she taught me how to care for her at home. How dare you treat her like she doesn't belong at your fancy party?" Similar calls were coming from dozens of families who had experienced Sarah's exceptional nursing care during their children's medical treatments. The outpouring of support demonstrated the profound impact that individual healthcare professionals could have on the lives of patients and families, relationships that extended far beyond clinical procedures to encompass emotional support and advocacy. Dr. Robert Kim, a pediatric surgeon who had worked with Sarah on hundreds of cases over the past decade, decided to speak publicly about the incident. "Sarah Mitchell is the nurse I want caring for my own family," he posted on the hospital's internal communication system. "She has saved more children's lives than anyone I know, and she deserves our respect and recognition, not discrimination." His statement was particularly significant because Dr. Kim rarely engaged in workplace controversies, preferring to focus on clinical care rather than administrative politics. His public support for Sarah carried weight among medical staff who respected his judgment and professional integrity. The pediatric intensive care nursing staff, who had been attending the gala to support their colleague and witness their unit's recognition, learned about Sarah's treatment through social media posts and live stream footage. They left the ceremony in protest, gathering in the hospital parking lot to provide support for Sarah and express their solidarity with her experience. "If Sarah isn't welcome at the recognition ceremony, then none of us belong there either," declared Jennifer Walsh, the unit's senior charge nurse. "We're not going to celebrate healthcare excellence while our colleague gets treated like she's not good enough to walk through the front door." Their departure from the gala was noticed by other attendees and further documented the growing solidarity among healthcare workers who recognized that Sarah's experience reflected broader issues of respect and recognition within medical institutions. Back in the emergency department, Eduardo Santos was recovering from his cardiac catheterization procedure when he learned about the circumstances surrounding his rescue. His wife, Maria, who had witnessed both Sarah's exclusion from the gala and her life-saving intervention, described the full sequence of events to her husband. "The angel who saved your life was treated like trash by the hospital security," Maria explained through tears. "They wouldn't let her into the party because she didn't look fancy enough. But when you collapsed, she didn't hesitate to help us." Eduardo was horrified to learn that his rescuer had been discriminated against by the same institution that he had supported with millions of dollars in donations. As a successful businessman and longtime hospital board member, he understood that organizational culture reflected leadership priorities and policy decisions. "I want to speak with this nurse immediately," Eduardo told Dr. Chen during her follow-up visit. "And I want to understand how this hospital treats the people who actually provide the excellent care that I've been supporting with my donations." Dr. Chen arranged for Sarah to visit Eduardo's room after her shift ended, explaining that her patient specifically wanted to thank her for saving his life and discuss his concerns about her treatment at the gala. Sarah was reluctant to meet with such a prominent donor while still wearing her nursing scrubs, but Dr. Chen assured her that Eduardo specifically wanted to see her as the professional nurse who had rescued him. When Sarah entered Eduardo's private room, she was surprised by the warmth and gratitude of his reception. Despite his recent cardiac emergency, Eduardo insisted on sitting up in bed to speak with her directly, treating her with the respect and attention typically reserved for distinguished physicians or major donors. "Nurse Mitchell, I understand that you saved my life tonight," Eduardo said, reaching out to shake her hand. "But I also understand that this hospital treated you shamefully before you had the opportunity to save mine. I need you to help me understand how this happened." Sarah was touched by Eduardo's genuine concern and his recognition of her professional contributions, but she was also reluctant to criticize the hospital that employed her. "Mr. Santos, what matters most is that you received the medical care you needed and that you're going to make a full recovery. Everything else is less important." But Eduardo pressed for details about her experience at the gala entrance and her perspective on the hospital's treatment of nursing staff. "Mrs. Mitchell, I've donated millions of dollars to this hospital because I believe in supporting excellent patient care. If the people who provide that care are being treated disrespectfully, then I need to reconsider my support." His questions opened a conversation about the everyday challenges faced by nursing staff at Metropolitan Medical Center. Inadequate staffing levels that compromised patient safety, limited resources for continuing education and professional development, and administrative policies that prioritized cost reduction over staff support. Sarah explained how budget cuts had reduced nursing positions while patient acuity increased, creating working conditions that made it difficult to provide the personalized care that families deserved. She described the emotional toll of caring for critically ill children while managing unrealistic patient assignments and administrative demands. "The nurses in our unit care deeply about our patients," Sarah told Eduardo. "We work extra hours without pay, we buy supplies with our own money when the hospital runs short, and we provide emotional support to families who are facing the worst moments of their lives. But we often feel like the administration sees us as expenses to be minimized rather than professionals whose expertise is essential for patient care." Eduardo listened intently to Sarah's description of working conditions and professional challenges, gaining insights into hospital operations that had never been shared with him during his years as a donor and board member. Her perspective revealed a disconnect between the hospital's public image and the daily realities faced by frontline healthcare providers. "Sarah, would you be willing to help me understand how we can better support nursing staff and improve working conditions for the people who actually deliver patient care?" Eduardo asked. "I want my donations to support the healthcare heroes who make this hospital excellent, not just impressive buildings and fancy equipment." Their conversation continued for over an hour, with Eduardo asking detailed questions about nursing education, professional development opportunities, patient safety concerns, and staff recognition programs. Sarah found herself serving as an advocate not just for her own unit, but for nursing staff throughout the hospital, who rarely had opportunities to communicate directly with major donors or board members. Meanwhile, the viral video continued to generate national attention, with nursing organizations and patient advocacy groups using Sarah's experience to highlight broader issues of respect and recognition for healthcare workers. Professional nursing journals requested interviews, and healthcare policy experts cited the incident as evidence of systemic problems within medical institutions. The American Nurses Association issued a statement supporting Sarah and calling for hospitals to examine their own policies regarding staff treatment and professional recognition. Sarah Mitchell's experience represents the daily reality for thousands of nurses who provide exceptional patient care while facing discrimination and disrespect from the institutions they serve, the statement read. Medical schools began incorporating the incident into curricula about professional relationships and healthcare team dynamics, using the footage to illustrate how unconscious bias and class discrimination could undermine patient care and professional collaboration. But perhaps most significantly, the incident sparked conversations within Metropolitan Medical Center about fundamental changes to institutional culture and staff treatment policies. The hospital's nursing staff felt empowered to speak more openly about working conditions and professional respect, knowing that their concerns were now visible to the public and to hospital leadership. Dr. Ashworth faced pressure from the board of directors to implement immediate changes that would prevent similar incidents and demonstrate the hospital's commitment to treating all employees with dignity and respect. The board had received dozens of calls from donors expressing concerns about institutional culture and demanding accountability for discriminatory practices. We need comprehensive policy changes that address both security protocols and professional recognition, Board Chairman William Foster told Dr. Ashworth during an emergency meeting. Our donors and the community expect us to treat healthcare workers as the professionals they are, not as second-class employees. The board approved several immediate changes, revised security protocols that prohibited discrimination based on appearance, mandatory sensitivity training for all staff members who interacted with employees and visitors, and enhanced professional recognition programs that celebrated nursing excellence alongside physician achievements. They also approved Eduardo Santos's proposal to establish the Sarah Mitchell Excellence in Nursing Fund, a permanent endowment that would support nursing education, professional development, and recognition programs. Eduardo pledged an initial contribution of $5 million to honor the nurse who had saved his life and to ensure that future nurses would receive the respect and support they deserved. This fund will ensure that nursing excellence is recognized and rewarded at the highest levels of our institution, Eduardo announced at a press conference held at the hospital. Sarah Mitchell demonstrated the kind of professional competence and human compassion that represents the best of healthcare, and we want to make sure that all nurses know their contributions are valued. Sarah was invited to serve on the advisory board for the Nursing Excellence Fund, providing her with a platform to advocate for policy changes and professional development opportunities that would benefit nursing staff throughout the hospital system. Her role gave her direct access to senior leadership and board members who had previously been isolated from frontline staff perspectives. 6 months after the incident, Metropolitan Medical Center had become a model for other hospitals seeking to improve staff treatment and professional recognition. The nursing staff reported significant improvements in working conditions, professional support, and administrative respect for their contributions to patient care. Marcus Webb, the security guard who had initially denied Sarah entry to the gala, was required to complete extensive sensitivity training and diversity education as a condition of continued employment. He publicly apologized to Sarah and began advocating for policy changes that would prevent similar incidents from occurring. "I was wrong to judge Nurse Mitchell based on her appearance," Marcus said during a hospital-wide staff meeting. "I failed to recognize that healthcare excellence comes from knowledge, skill, and compassion, not from expensive clothes or social status. I'm committed to treating all healthcare professionals with the respect they deserve." The incident also prompted changes in hospital policies regarding employee recognition and access to institutional events. All healthcare workers were granted equal access to professional recognition ceremonies, and dress codes were modified to acknowledge that medical professionals often came directly from patient care responsibilities. Dr. Ashworth herself underwent significant personal and professional transformation as a result of the incident and its aftermath. She began spending regular time on patient care floors, engaging directly with nursing staff and other healthcare workers to understand their perspectives and challenges. "The viral video taught me that I had lost sight of what really makes this hospital excellent," Dr. Ashworth reflected during a nursing staff appreciation event. "It's not our marble floors or crystal chandeliers. It's the knowledge, skill, and dedication of healthcare professionals like Sarah Mitchell, who save lives every single day." The pediatric intensive care unit that Sarah led continued to achieve outstanding patient outcomes, while also becoming a model for professional nursing practice and interprofessional collaboration. Medical students and nursing students from across the country requested rotations in the unit to learn from Sarah and her colleagues. Sarah herself became a nationally recognized advocate for nursing professional recognition and workplace respect. She spoke at conferences, wrote articles for professional journals, and consulted with other hospitals seeking to improve their organizational culture and staff treatment policies. But she remained most proud of her direct patient care work, continuing to provide the compassionate, expert nursing care that had defined her career long before she became famous. "The real reward isn't recognition or awards," Sarah reflected. "It's knowing that we're making a difference in the lives of children and families during their most vulnerable moments." The viral video had inadvertently created the most powerful demonstration possible of nursing expertise and its essential role in healthcare delivery. Millions of viewers had witnessed firsthand the life-saving skills that nurses applied daily, the professional respect they commanded from physicians and other healthcare providers, and the dedication they brought to caring for others. Eduardo Santos made a complete recovery from his cardiac emergency and remained a passionate advocate for nursing recognition and support. He frequently visited the pediatric intensive care unit to observe the excellent care provided by Sarah and her colleagues, and he continued to increase his donations to support nursing professional development. "Sarah Mitchell saved my life twice," Eduardo often said when speaking about healthcare philanthropy. "First, she saved me from cardiac arrest. Then, she saved me from ignorance about what really matters in healthcare excellence." The incident at Metropolitan Medical Center became a case study used in healthcare administration programs across the country, illustrating how organizational culture and staff treatment policies could impact both employee satisfaction and institutional reputation. It demonstrated that true healthcare excellence required recognizing and supporting all healthcare professionals, regardless of their appearance or position in traditional medical hierarchies. Most importantly, it showed that viral videos and social media attention could sometimes create positive change, forcing institutions to confront discrimination and professional disrespect that might otherwise have remained invisible. Sarah's experience had given voice to countless healthcare workers who provided exceptional patient care while facing similar challenges and discrimination. The story concluded with Sarah receiving national recognition as Nurse of the Year from the American Nurses Association, an award that celebrated both her clinical excellence and her advocacy for professional respect and recognition. The ceremony was held at Metropolitan Medical Center, with Sarah entering through the main entrance as the guest of honor, surrounded by colleagues, patients, and families whose lives she had touched. This award represents all the nurses who provide excellent patient care every day while facing challenges and discrimination, Sarah said in her acceptance speech. We don't do this work for recognition or awards. We do it because we believe that every person deserves compassionate, expert health care, regardless of their circumstances or our own. The viral video that had begun with discrimination and humiliation had ultimately transformed an entire institution and sparked national conversations about respect, recognition, and the true meaning of healthcare excellence. Sarah's professional competence and human dignity had triumphed over prejudice and superficial judgments, creating lasting change that would benefit healthcare workers and patients for years to come. If this story touched you, please like this video, subscribe to our channel, and tell us in the comments what part resonated most with you. Until next time.